Welcome to the Deep Dive. Today we're unpacking Cochlear Limited. They're the big name, the global leader in implantable hearing solutions. You probably know them for their tech, but, well, our sources paint a much more complex picture. It's not all smooth sailing, despite that market dominance.
Exactly. Our mission here is to, go beyond just the headlines. We're digging into a critical analysis that really shines a light on the persistent legal, ethical, and technological challenges they face. Even with their clear market leadership, there's a lot simmering beneath the surface.
Okay, let's jump right in. First up, product integrity. Or maybe lack thereof sometimes. That 2011 global recall of the Nucleus CI500 implant series, that was huge.
Oh, absolutely pivotal. It ended up costing Cochlear, what was it, $138.8 million pre-tax, a massive provision.
And it absolutely hammered their profits, right?
Yep.
A 68% collapse in annual net profit. Huge.
Massive. But here's where it gets particularly interesting, maybe even concerning.
Go on.
Well, Cochlear initially reported pretty low failure rates for that CI500 series. Standard procedure maybe, but then you had independent academic research coming out, like a study from Tulane University found something quite different.
Different how?
Alarming, really. They found a cumulative failure rate of 9.8% for the CI500 implants at their center. That's already way higher than you'd want.
Nearly 10%. Yeah, that's significant.
But wait, it gets worse. For the devices manufactured after Cochlear actually initiated the recall, but which were still implanted at that Tulane center.
Uh-oh.
The failure rate shot up to a staggering 25.0%, 1 in 4.
25% after the recall started. Wow. That raises some serious questions about transparency, doesn't it? And their post-market surveillance.
It certainly does. What was happening internally? How clear was the communication? Big questions.
Okay, so product issues are one thing. Let's pivot. Another battleground for them seems to be intellectual property, patents.
Right. IP has been, well, both a crucial asset and a major source of trouble for them. Very costly, high-stakes litigation.
Like that case with the Alfred E. Mann Foundation and Advanced Bionics.
Sure.
That resulted in a massive judgment against Cochlear.
US $268 million. And crucially, that loss was made worse by a finding of willful infringement.
Willful. That means the court thought they knew they were infringing and not just an accident.
Exactly. It implies intent, which carries heavier penalties and reputational damage. And just to appeal that decision, they had to put up a US $335 million insurance bond. Huge sums involved.
So how do they defend their tech now, especially as older foundational patents expire?
Good question. They're now relying heavily on creating what's often called a patent thicket.
A thicket.
Yeah, basically a dense web of patents covering lots of smaller incremental innovation. Things like, advanced signal processing, different ways to transfer energy wirelessly to the implant.
So layering lots of small patents on top of each other.
Precisely. It makes it much harder for competitors, especially low-cost ones, to navigate around their IP portfolio. It's a necessary strategy for them, probably, but it's also really complex and continuously expensive to maintain. A defensive moat, but a costly one.
Seems like a constant battle.
Right.
Okay, so we have product reliability questions, expensive legal fights, but the challenges go deeper, don't they, into ethics?
They really do. Cochlear operates on a very tricky ethical tightrope. Several fronts, actually.
Let's start with the deaf community. There's a fundamental tension there, isn't there?
A major one. Cochlear's entire business model is built on the medical view of deafness. Deafness as a condition to be treated or fixed with technology.
Right.
But this clashes directly with how many in the deaf community see themselves. For them, deafness isn't a medical problem. It's a cultural identity with its own rich language like ASL and heritage.
And this leads to some strong accusations.
Yes, including things like cultural genocide, arguing that promoting implants over sign language erodes deaf culture. It's a deeply felt conflict.
And organizations like the National Association of the Deaf have a stance on this.
They do. The NAD now strongly emphasizes how critical early access to visual language, like ASL, is for all deaf and hard-of-hearing kids, even those who get implants.
Why even with implants?
To prevent something called language deprivation. If a child doesn't get accessible language input very early on, whether spoken or signed, their cognitive development can be seriously impacted. So ASL provides that crucial foundation regardless of hearing technology.
That's a really important perspective. What other ethical areas are there? Animal research seems to be one.
Yes, that's another flashpoint. Cochlear's research partners, like Australia's Bionics Institute, have faced strong criticism from animal advocacy groups.
What kind of criticism?
Well, groups like Animal Free Science Advocacy have published details about experiments they find cruel. They've cited repeated experiments involving kittens being deafened shortly after birth, then used in cochlear implant research, and ultimately killed. That's obviously highly controversial.
Definitely. And then there's the corporate conduct side. Issues with how they market or sell devices.
Right. Back in 2010, Cochlear Americas settled with the U.S. Department of Justice. They paid U.S. $880,000 to resolve allegations of illegal kickbacks to physicians.
Kickbacks. How did that supposedly work?
The allegations included things like offering clinics a free dummy billing service, which sounds like helping them process claims, maybe in a way that favored Cochlear and a partners program?
Partners program.
Yeah. It allegedly gave clinics credits they could use towards free cochlear products when they implanted cochlear devices. Essentially financial incentives tied to using their product.
That definitely complicates the narrative that decisions are based solely on the patient's best interest.
It certainly does. It casts a shadow. So when you step back, you see these threads connecting the product failures, the expensive lawsuits, these deep ethical debates.
They all seem intertwined.
Exactly. They create this persistent drag on Cochlear's reputation and require constant, costly management effort, even while they dominate the market financially. It's a fascinating tension.
So pulling this all together for you listening,
Yeah.
what does it really mean? I think it underscores that even highly successful, dominant companies, especially in sensitive fields like medical tech, operate with significant inherent risks.
Risks that anyone involved, investors, patients, clinicians, policymakers, really needs to understand and factor into their thinking.
Absolutely. This deep dive really makes you think about the huge responsibilities that come with pushing the boundaries of medical innovation.
Yeah.
It leads to a final thought, maybe a question for you to ponder.
Yeah.
What do you think is the single biggest challenge, the trickiest tightrope to walk, when a company's powerful, advanced technology meets these really complex human needs and ethical considerations? Where does that friction become most intense? Something to think about. Okay, so let's talk about neurofeedback. You've probably heard of it, this idea that you can tap into your brain's own power to change itself, its neuroplasticity,
Right.
and use that to regulate your brain activity. It's pitched as this non-invasive, drug-free answer for, well, a whole range of things. Anxiety, ADHD, even chronic pain.
It offers real-time feedback on your brainwaves.
Sounds pretty amazing. Almost too good to be true sometimes. So today we're going to, dive deep and see what's really going on.
Yeah, and it's fascinating because neurofeedback's been around for like over 50 years, but it's still incredibly controversial, a real lightning rod.
Really? Why is that?
Well, there's this persistent debate. A lot of the science suggests the benefits people report might just be strong placebo effects,
Oh, okay.
amplified maybe by how high-tech it all seems. So the big question is, does it actually work as claimed, or is the industry mostly selling hope at a high price? That's what we want to give you a framework for today.
Got it. So let's start with the science, the bionic idea. It's a type of biofeedback, right?
Exactly. Specialized biofeedback. It uses operant conditioning, learning through rewards, but applies it to your brain's electrical activity, the EEG signals.
So sensors read your brain waves.
Right, and you get feedback like sounds or visuals. The goal is to reward the brain states you want, like, say, more alpha waves for calm or beta for focus.
And the hope is that your brain learns this, uses its neuroplasticity, and you get lasting benefits.
That's the theory. And proponents claim it works really well for certain things. ADHD is often mentioned as a big success story.
Yeah, I've heard some say it's as good as medication.
Some providers do claim that, yeah. And they might point to, like, an American Academy of Pediatrics Level 1 rating, though that's debated, too. Then there's mood and anxiety.
What's the claim there?
Well, recent meta-analyses have linked it to fewer depressive symptoms. And for PTSD, one review mentioned a really high remission rate, almost 80%. Plus, the FDA cleared a device called PRISM for PTSD.
Okay, so that adds a layer of legitimacy.
It does, and you also see it promoted for, like, peak performance in sports or the military.
That all sounds very positive. But you mentioned controversy. What do the critics say? Is there another side to this?
Oh, absolutely. Critics point strongly to this neuroplacebo idea. They highlight well-designed studies, the placebo-controlled ones.
And what do those find?
Often, they find neurofeedback is no better than a sham procedure, something designed to look like neurofeedback but isn't actually giving real feedback.
Okay, like a sugar pill, but for brain training.
Kind of. There was a big study, Shabas et al., in 2017 on insomnia. Both the real and the sham groups said their sleep got better subjectively, equally better.
But did it actually get better? Objectively?
Nope. No change in objective sleep measures, like from a sleep study. And crucially, learning to change their brain waves wasn't linked to feeling better.
So the experience itself might be the active ingredient.
That's the neuroenchantment or super placebo hypothesis. Robert Thibault and others argue the cool tech, the patient being really involved, the whole retrain your brain story, it all creates this powerful non-specific effect.
More powerful than a typical placebo.
Potentially, yeah. Another study just this year found people could learn to regulate brainwaves related to pain, but it didn't actually change how much pain they felt.
But the proponents must push back on these studies.
They do. They argue the sham-controlled trials are flawed, maybe using protocols that don't really align with operant conditioning principles, effectively comparing like two types of fake feedback. So they say it doesn't disprove real neurofeedback.
So kind of a stalemate. And you mentioned something about infralow frequency, ILF.
Yeah, that's a newer thing from Siegfried Othmer. It targets really slow brain activity, below 0.1 hertz, and kind of ditches the reward system for endogenous neuromodulation.
Does it have better evidence?
Not really. It's mostly case studies, very little rigorous research, and there's some anecdotal reports of it actually making symptoms worse. Critics see it as maybe moving the goalposts to avoid scrutiny.
And you have to wonder about conflicts of interest here, too.
Definitely. A lot of the supportive research comes from people with direct financial stakes, like Othmer himself. The critics tend to be meta-researchers without those commercial ties.
Which brings us to the marketplace. This stuff isn't cheap, is it?
Not at all. In-clinic sessions can be $100, $200, sometimes $300 per session. An initial assessment, like a key EEG brain map, can be hundreds, maybe even $1,000.
Wow. So a full course, maybe 20 or 40 sessions.
You're easily looking at $3,000 to $8,000, maybe more.
Yeah.
And home rentals or buying systems, that's thousands too. And here's the kicker for you. Insurance usually doesn't cover it. It's mostly out of pocket.
Ouch. And how is it marketed?
Very aggressively. Almost all provider websites claim it treats clinical issues, anxiety, ADHD, depression. Lots also push cognitive enhancement.
Using what kind of language?
Things like brain gym, exercise for your brain, lots of natural alternative holistic language, and tons of emotional testimonials.
And who are the practitioners? Are they typically doctors or psychologists?
Often not. One analysis found only about a third had that level of qualification, which is concerning. We saw this with Neurocore big claims, Betsy DeVos investment.
Right.
But regulators like the FTC found their claims were unsubstantiated.
So regulation seems like a big issue here. How does the FDA handle this?
It's complicated. Neurofeedback devices are Class 2 medical devices, but many get an exemption from review if they're just marketed for general wellness, like relaxation or stress management.
Ah, so they get sold for general wellness.
And then practitioners use them off-label for specific conditions like ADHD or PTSD, completely bypassing FDA checks for those uses.
That seems like a pretty big loophole. What about billing insurance?
It's a mess. There's no specific code for neurofeedback. Providers often use a general biofeedback code, but insurers frequently deny it for psychological conditions, calling it experimental.
And that opens the door for
Potential fraud. There was a huge $15 million case involving Golden Victory Medical LLC for misusing billing codes related to this. Plus, professional standards, like certifications from BCIA or ISNR, they're voluntary, not legally required to practice in most places.
So a low bar to entry for practitioners.
Very low, yeah. Which contrasts sharply with, say, the VA, which has strict requirements if they use it. Major insurers still consider it investigational.
Okay, so to put this all in perspective for listeners, how does neurofeedback stack up against treatments we know work, the gold standards?
Right, let's compare. You've got cognitive behavioral therapy, CBT, highly structured talk therapy, huge evidence base, first line for depression, anxiety, PTSD, often works as well as or better than meds.
And then you have medications themselves.
Exactly. FDA-approved drug stimulants for ADHD, SSRIs for depression anxiety. They go through rigorous testing for safety and effectiveness, prescribed by licensed professionals.
No head-to-head efficacy.
Neurofeedback's evidence is contested, often no better than placebo in good trials. CBT and meds have robust, specific effects, proven superior to placebo.
Cost and time.
Neurofeedback, very high cost, lots of sessions, rarely covered. CBT, usually shorter, widely covered. Meds, also widely covered.
And regulation and safety.
Neurofeedback operates in that gray area, unvetted device as possible, minimal oversight, some reports of side effects. CBT and meds are highly regulated, delivered by licensed professionals.
So wrapping this up, what's the key takeaway for someone listening, maybe considering neurofeedback on their own mental wellness journey?
Well, it seems clear there's often a big gap between the marketing hype of the neurofeedback industry and the actual scientific evidence. Combine that with the high costs and the murky regulatory situation.
Yeah, it paints a challenging picture.
It does. So for you, the listener, it probably means prioritizing the treatments with solid evidence. First, things like CBT or appropriately prescribed FDA-approved medications. Think of those as your first line of defense.
And if you're still curious about neurofeedback,
approach it with, shall we say, extreme skepticism. Demand clear credentials from any provider. Understand that for most things it's marketed for, it's still highly experimental and largely unproven.
It really makes you think.
It does. It leaves you with a question, doesn't it? In a world where hope is valuable and this sort of neuromystique can be so appealing, how do you personally navigate this landscape? How do you tell the real breakthroughs from the slickly packaged promises that might not hold up, especially when it comes to something as important as your well-being?